Despite healthcare and medicine being founded on physiology, anatomy, fact, evidence, and clinical trials, sometimes inaccuracies get perpetuated for years. I'm cancer physical therapy specialist, Dr. Leslie Waltke, and regardless of what your grandmother told you, here are the proven facts. Being cold and wet cannot make you sick. Antibiotics are completely useless against cold and flu viruses. Shaving does not make your hair grow back quicker, darker, or coarser. Eating fried foods and chocolate does not cause acne. Cell phones do not interfere with hospital equipment. You can't catch an STD from a toilet seat. Our hair and fingernails do not continue to grow after we die. Reading in dim light does not cause permanent eye damage. Coffee does not dehydrate you. And if you have had lymph nodes removed from your underarm, listen closely. Blood draws, IVs, blood pressures, repetitive movements, and flying do not, I repeat, do not increase the risk of developing lymphedema. You most likely have been told not to have blood draws, IVs, or blood pressures done on your arm with lymph node removal, and to wear a sleeve when you fly. These inaccurate precautions were developed decades ago, not based on science, but on conventional wisdom and surgical procedures of that time. And they unfortunately have been repeated by habit by the cancer survivor and medical communities over the years. Multiple studies show that needle sticks, blood draws, blood pressure exams, IVs, repetitive activity, and flying do not increase lymphedema risk. Therefore, we need to stop spreading the myth that these things are dangerous. To be clear, this change in lymphedema precautions applies to people at risk for lymphedema, not to people with lymphedema. Now, though there is nothing controversial about the research that clearly shows that IVs, blood pressures, etc. do not increase lymphedema risk, almost all cancer centers, doctors, nurses, physical therapists, and phlebotomists are still following the outdated guidelines. So you, my friends, are on the cusp of medical advancement. The next time someone tells you to protect your arm from flying, repetitive activity, IVs, sterile needle sticks, or blood pressures, you can now say, did you know that those precautions were never based on science or research, and that reputable studies published in reputable journals have actually shown them to be safe? Yes, having lymph nodes removed from your underarm puts you at risk for developing lymphedema. What increases this baseline risk is radiation to the underarm, being overweight or gaining weight, having an arm that isn't strong and flexible, getting a cellulitis or infection in that arm, and not partaking in regular exercise. If your arm is currently not fully strong, flexible, and mobile, and working perfectly, get in to see a physical therapist to make that happen. To learn more about lymphedema, please visit the Recovery Room video library on YouTube and click on the Lymphedema Information playlist. I'm Dr. Leslie Waltke, founder of the Waltke Cancer Rehabilitation Academy. Thanks for joining me in the Recovery Room. Care well for yourself. We'll talk again soon.